When do we suggest surgery for a woman who has fibroid uterus? So majority of the women are asymptomatic and we don't suggest any treatment, but we just ask them to follow up once in 3 months or 6 months to just check if the fibroid is drastically increasing in size. If the woman has a fibroid which is more than 10 centimeters, then she needs to undergo a surgery. And if the woman has symptoms of heavy bleeding with severe pain, whatever the size of the fibroid is, and if it is causing anemia, that is dropping her hemoglobin to less than 10, then also she will need a surgery. If the woman is having fibroid and if it is close to the endometrial cavity and if she is suffering from fertility issues, then also whatever the size of the fibroid may be, we still advise her to undergo the surgery for the fibroid. Many a times we see that there are huge fibroids like more than 10-12 centimeters and the woman doesn't have any symptom. So what do we suggest in this case? In this case, we give them the option that they have to be under close monitoring, but most of the times we counsel them and tell them that such big fibroids may cause pressure symptoms and it may compress the kidneys and it may cause problems in the future, so the removal is advisable. If at all, if a woman has a lot of symptoms and if she is willing to undergo the surgery, now we have two options, that is either do a myomectomy, that is a removal of the fibroid, or do a hysterectomy, which is removal of the uterus. These can be done either by laparoscopic route or they can be done by an open method. And sometimes if the fibroids are very small and if they are into the endometrial cavity which can be removed from below, we do it through hysteroscopy. So the individualistic treatment in opting for surgery or giving the option of surgery is extremely important, where the woman understands the risk and she has to decide whether she wants to go for the surgery or not based on her symptoms, based on the size of the fibroid, location of the fibroid and her desire to conceive. Many a times the fibroids will be very fastly growing and we may suspect cancer in huge single fibroids. That time also surgery is a mandatory thing which we tell the patient. So these are about the surgery when we advise for fibroid uterus. Thank you.